Hi, my name is Ashley. It is nice to meet you. I am your nurse, and can I just have your name and date of birth?
Yeah, Jenna Bronke, August 5th, 2002.
Awesome. And I hear you are here today because of asthma.
Yeah.
And this is a private space, so we're just going to talk about Preventil a little bit and educate you.
Okay.
The nursing diagnosis that I have for you is ineffective airway related to asthma, as evidenced by you saying that you are coughing more than 2 times a week.
Yeah.
Some of the goals that we have for you today is I want you to leave here understanding your therapeutic regimen.
Okay.
I also want you to be able to demonstrate behaviors that will improve your airway.
Mm-hmm.
And I also want you to be able to tell me any type of complications that you may have.
Okay.
Okay, so is right now a good time for you to talk to me?
Yeah, no, that's fine.
Okay, alright, I'll put that away. So, are there any learning barriers I should be aware about?
No.
Okay, alright. And the trade name of the drug is Preventil, and the generic name is albuterol.
Okay.
And the Preventil works in the body by relaxing the airways and dilating them and making it easier for you to breathe. It activates the sympathetic nervous system.
Mm-hmm.
The goal of this medication, like I said, is to help you breathe.
Mm-hmm.
Some side effects of this medication are nervousness, restlessness, and low potassium. One way to combat these side effects is to go and do yoga or deep breathing exercises, anything that will calm you down.
Okay.
Some interactions that Preventil has with other drugs are potassium. You shouldn't take this drug with potassium-sparing or potassium-losing diuretics, because then it already has the side effect of low potassium, so if you take too much, it's not good.
Okay.
It says here in your chart that you know all about Preventil, but I just wanted to go over a few things with you. So when you take Preventil, you want to remove the cap, you want to shake the medication, you want to breathe out, and you want to hold the canister down, you want to breathe in. And then you want to hold that breath for 10 seconds and then release. And then you're supposed to do that 2 puffs a day. So then before you do the second puff, you want to wait for that for a minute.
Okay.
And then you retake it and you do it again. And then you take that 4 times a day. So the best times to take it would be like the morning when you wake up, like breakfast time, lunch, dinner, and like at night at bedtime. Those are good times.
Okay.
When you are handling your inhaler, it is a good idea not to drop or break the container. Are there any cultural considerations that I should be aware of?
No.
No? Okay. And now that I went over some stuff, I want you to explain your therapeutic regimen, if you are able to.
Yeah, so I'm going to take Preventil 4 times a day, and I'll do 2 puffs each time that I take it, just to help me breathe better.
Awesome. Okay. And are you able to tell me any complications that you might face?
Yeah, so if I don't use it as prescribed, or if I miss a dose, then it won't maintain my airways.
Perfect. Exactly. And are there any? Do you know any ways to that what could increase, help your airways stay patent and dilated?
So I could do yoga or deep breathing.
Yeah, exactly. And do you have any questions for me?
Yeah, why is nervousness and restlessness a side effect?
Oh, that's a side effect because the drug, it activates the sympathetic nervous system, which is your fight or flight. So whenever you're in fight or flight, you're nervous and you're restless. And like I said before, doing yoga, deep breathing exercises would really help with that. Do you have any other questions for me?
Yeah, what if it doesn't work?
If it doesn't work, I would call your primary care provider, us, but if it is a true emergency, you can always go down to the emergency room.
Okay.
And do you have any other questions for me?
No, that's it.
All right, thank you so much. I hope you have a wonderful day. Nice seeing you.